Across the United States, weight loss has become a national conversation. At the center of it is a small medical injection pen. Names like Ozempic and Wegovy are now part of everyday language. These medications were originally developed to treat diabetes. Weight loss appeared later as an unexpected secondary effect. Today, millions of Americans receive these prescriptions. Clinical studies show meaningful weight reduction for many users. Some individuals lose up to 15% of their body weight. These drugs work by influencing hormones that regulate hunger. They help people feel full sooner and eat less. However, appetite control is not the same as metabolic repair. Some users experience subtle side effects over time. Rapid weight loss can also lead to muscle loss. And when medication is stopped, weight may return. Doctors emphasize these medications are tools, not cures. Lasting results come when medication supports healthy habits. Follow for evidence-based health.